Hi, I'm the lovely Debbie McGee.
Are you? Oh, and I am the gorgeous Debbie Arnold.
Oh, we've got so much for you in the show today, including the wonderful aesthetic pioneer Dr. Patrick Treacy, of course, who joined us for a previous episode.
Yes, he just absolutely wonderful. He has so much information. He's so interesting to talk to. It's like having your head in a washing machine. Anyway, also, Natalie is here with some more nuggets, and we've got more wit and wisdom from Ate.
And we're going to catch up with our very own Dee after her lower facelift.
I'm so relieved it's over.
Yes, I know you are. So stay with us for some more Beauty Investigates. It's lovely to have you back on the show.
It's lovely to be back.
Dr. Patrick Treacy.
Yes, I know.
I would like to know a bit more about treatments because when you started to now, so much has changed. And would you say that social media has also brought a lot more people to you because of the pressure of got to look good on my social media posts?
The number of people coming is exponential worldwide. So this is exploding, social media or not. I was in Pakistan recently and I was just there for a lecture and I had a line of doctors and film stars that all wanted their faces injected. There's no doubt about it that social media has changed things for us. Originally we had a lot of people coming in with pictures of Kylie Jenner's lips and say, I want my lips to look like that. So we have to be very careful with social media. It works in our favour and against us. A lot of doctors, I think, too loosely use social media to promote themselves and using patients' pictures to do that. Whereas I suppose more conventional doctors, particularly in hospitals, or maybe like myself, don't like that approach. I think it lowers the tone of aesthetic medicine a little bit. And then there's no doubt about it that people have unrealistic expectations of their outcomes.
My mother was a beauty queen in the 50s, and she used to say to me, God gave me nothing but my looks.
Yes.
And she was gorgeous and she knew it.
Yes.
And I think now everybody's saying, oh, but I don't like my nose,
So
I don't
you
like my
inherited
lips.
this? Is that what you're telling us?
Sadly, I look like my dad.
I mean, we've never discussed this, but my mum was too. So there you go. Yeah.
So obviously you look like your dad as well.
I do look like my dad, but she only entered one competition because in those days it was kind of a fun thing to do.
During the last war, they needed all the metal they could get, so all the makeup tubes for lipstick were replaced with plastic or paper. Although the quality went down, the usage didn't. Women were absolutely encouraged to wear as much lipstick as they wanted to keep up the morale. This one's been recreated by the seamstress of Bloomsbury, and it's the most wonderful 40s red.
Tell us about some of the treatments you actually perform and for what reasons.
The body reacts to these stress mechanisms by repairing themselves. So if you do something like a CO2 laser, which is still probably the single best treatment, there's no doubt about it. It lasts for 5-6 years, and over 20 years it really has never lost its appeal.
Wow.
The problem, of course, is it takes at least a week to heal, 5 days.
Does that make your face go all red and crusty? What happens when you have the CO2
There's different
laser?
types of lasers.
Okay.
The erbium sometimes can do that. The CO2 doesn't tend to. It tends to just go redder, and then gets better and better. The next step after that was to use what is called microneedle radiofrequency. And this is also a means of wounding the dermis, but you can protect the epidermis on the way in. With a laser you can't because it goes through everything. So you can put a little plastic sleeve over the electrodes, so when they go in, they just target the dermis itself. And you'll heal from that within 1 or 2 days. The downside is that you need 4 or 5 treatments, maybe 3 to 4 weeks apart. But most people now are combining the two.
So if I had this done, I mean, the décolletage is something, isn't
Absolutely, yeah. So I had to go to Vegas in 2007 to show them our settings, but I didn't tell them that our first patient took 3 months to heal until we adjusted the settings.
So is it painful?
Yes, it can be painful. So as a consequence, you use regional blocks. We can block most of the forehead by little injections here, and also around the perioral area. So, I mean, you can block, you know, sort of the nerves for maybe about half an hour. So it usually is painless, and also obviously a very strong topical anesthetic, 25% lidocaine.
So it does. So you can do necks and chests.
Totally, yeah.
So how successful are the chests now?
With the laser,
Yeah.
oh, very successful, and the backs of hands. But you still would need an experienced laser surgeon to do it, because certainly the machine's the machine, but the operator makes all the difference.
And now she's back at A with more of her incredible investigations.
I wonder what they'll be this time.
Hi everyone, I want to tell you about a gem beginning with C. It's a bit offensive to some people, but it's CBD. And you know what, I'm a child of the 80s and 70s, and when people say marijuana or CBD, all I think about is reefer madness. But CBD is not going to get you reaching for the munchies. It is one of the most healing things for your well-being. Great for sleep, anxiety, really great when used as a body balm. And I'm absolutely obsessed with Dreams Distillery, so much to the point that I've just signed as ambassador, which I'm very proud of because I use this religiously. There are night drops, which you just take a little bit of the dropper, you put it under your tongue, and it really helps you to have a beautiful sleep. I'm a very bad sleeper. I've got ADHD. If, like me, you do not like to wind down at night time, this is really great for you. Also, the bed balm, it makes me want to sing Sabrina Carpenter. Bed chem, bed balm. The bed balm is amazing to go to bed with. You rub it on your décolletage, you can rub it on sore legs, anywhere that you need a little bit of TLC for aches and pains. And it really helps to make you feel relaxed and go to bed in a beautiful state. Dream Distillery, they also have bath salts, and they've got a body oil and a bath oil. There's a whole range, but these are my little bedtime companions that always put a smile on my face.
Now it's the day after Dee's surgery.
Yes, and she's going to be starting a video diary so we can see what she looks like every single day, so I won't be so worried anymore.
I can't wait to see this.
No, I can't either.
Thank you, girls. Now let's catch up with the rest of my facelift journey. When I look in the mirror, I have a little jowly bit here. It knocks my confidence a bit. I know that it could be improved. I want to be the best version of myself. I was introduced to this guy, Dr. Siva Kumar, who I absolutely love.
The surgery is going to take about 3.5 hours to do.
I'm having a lower facelift.
Dee will be under general anaesthetic, so she'll be asleep. She won't know anything about it at all.
A couple of days ago, I thought, why am I doing this? Why am I doing this? I trust Dr. Shiva.
What we're going to do is we're going to try and tighten up all of this skin.
This is the first and last facelift I'll ever have.
Remove the skin from around here and get this looking a lot tighter. I think the best part of my job actually is seeing the reaction from my clients after they've actually had the treatment. It's very satisfying.
It's the day after, the morning after, and I feel okay. I was just preparing myself for really bad pain. I've had no pain. Dr. Shiva has really worked his magic. A bit tight, but it's okay. Well, day 2, and I feel a lot better. Apparently, the peak of the swelling is today and tomorrow, but I'm feeling absolutely fine. I'm just amazed at how little scarring there is. No bruising at all, which is unbelievable for me because I bruise quite easily. Being in here is amazing. It's like I need to take more time out like this going forward. It's really taught me that I need that. I need the downtime. I'm home. I'm home. I'm now going to settle down, watch some telly, have something nice to eat, and I'm back in my own bed. How easy is that? Well, I had a great night's sleep at home and woke up, just had some toast and honey and coffee, my favourite coffee. I'm really looking forward to reading today catching up on some books, maybe some audio books, and I've got my laptop in here so I can watch any telly at all. It's getting a little bit better every day, isn't it? I feel good, I feel better every day, and I'll soon be coming out to play. Swelling's going down, looking a lot better. I'm keeping this on because, though sometimes it gets tight, it's better to keep it on as much as possible because it reduces the swelling. I was terrified going into surgery, I'm not going to lie. It's taken me nearly a week to admit to that, but it was absolutely nothing. I was in fantastic hands, and it's really important that you choose the right surgeon and the right environment for you to do this, to be safe. The results are phenomenal. It's miraculous, really. I've still got the compression gear on, but I actually put some makeup on this morning. I thought eyes and lips is not going to affect anything, because the little scars are, I can't even call them scars because they're so minuscule, are in front and behind the ears. I've actually been out for a drive, did a bit of shopping, and feeling 100% better. The face is just getting better every day. I do feel that I've changed something fundamental in my whole life, which sounds a bit dramatic, but it's true, and I think it was a very big decision, so very big outcome. I've washed my hair and put a bit of lippy on, a little bit of eye makeup as well. I mean, you can see it's all going around here. Thank you, Dr. Shiva. Thank you.
Now it's time to talk sexual rejuvenation with one of Harley Street's finest, Dr. Wakil.
Okay, today we are talking about a very important complaint. Sagging in the labia majora. I don't really like how it looks. A lot of patients come to me and tell me the labia majora, the bigger labia, is a little bit wrinkly, a little bit saggy. What can I do? It makes our confidence really low when we took off our clothes. Very simple. Do you know the filler that we inject in the lips and the cheeks and the temples everywhere? Yes, hyaluronic acid. This is precisely what we inject in the labia. We go down here after putting some topical anesthesia and some local anesthesia with a cannula, which is exactly like needle, but it's a bit blunt. And as a result, we puff the labia out, not too much so it doesn't look like a camel toe. Very subtle changes. It makes it really nice and neat, and they come together so they close on the penis during intercourse. And a lot of ladies come after that treatment and say, thank you very much, this is a life-changing procedure.
Should we do also those lines here?
You did something last week.
Yeah, maybe I top up a bit.
And also this is a bit, just here. I'm going to have some more face design by Dr. Ivy.
My name is Ivy Igerc, and I'm in aesthetic medical field.
That's good, there is no lines here, so I can put a little bit of filler, more filler here.
I come to Ivy to literally tweak me.
Little and often approach, yeah.
Top up here.
You see little jowly bits here.
And top up here.
Little bits there.
Yeah, right up there. Okay.
Debbie looks amazing. Debbie looks stunning. Beautiful person inside out, and the only thing she needs actually are these little tiny tweaks.
The tweaking starts when I notice things. If I don't notice anything, then I don't get tweaked. But suddenly it all seems to happen at once. You know, the Botox wears off and this happens and that happens.
Face is so complex, has 43 muscles, a lot of nerves, 2 layers of fat pads, so we have to tackle it all to bring out the most natural and best version of a person.
Ivy is my goddess. Well, we all want to look like Ivy. But I think it's because she does this face design, and it is different. And the first time I had it done, which is probably over a year ago now, the difference it made was absolutely incredible. So now I'm back for her to redesign my face.
When I first see a patient, I try to understand what is the best feature on the patient face. It's about everything together: neck, eyebrows, nose, position of the lips. And then I start my little plan how to bring those features into best harmony.
I don't like the look of fillers, and that's why Ivy is so good. The little bits that she puts in are just tiny little bits. People won't look at me and go, oh my God, what have you had done?
Beauty is like riding a wild horse. You need to control it. If you don't control it, it can go very wrong.
Totally trust her.
Beauty lies in discipline. This is just to underline the jawline. So I can do everything, but if the patient doesn't come back for this little tweak, which is more important, believe it or not, than the first step of all facial transformation, this little tweak keeps it going.
So you give me a little thread?
Little threads inside.
How did you do that without even noticing?
There is not so much joy as when I finish my face design and I see this patient and his beautiful enhancement. That's what keeps me going.
She's so wonderful.
Now it's Dr. Patrick Treacy.
We should look at maybe some of the new things that are coming on
Yeah,
the market.
absolutely.
Yeah, people in this generation are tending to move away from the, I suppose, Joan Rivers look, more to the Lindsay Lohan look. So they're sort of going away from tight, fixed, pulled skin and moving from dermal fillers, which I love, to more bioregenerative things. So the sort of things that are in the market, this is exosomes. So they discovered recently the little vesicles within cells that they thought was just there as a garbage to get rid of waste products actually contain signal messengers to code skin to regenerate, to make chromosomes last longer, to block telomere shortening, to boost our immune system. And as yet, in Britain and in Europe, we're not allowed to inject these, but a beautician can roll them in. And now they've done some trials in Sweden, and I believe soon in Dubai also, where they're going to inject them into blood vessels. So there's human ones and plant ones, and as yet we're not allowed to use human ones because of the risk of it carrying some, I suppose, malformed DNA to form cancer. So exosomes are interesting from the point of view this will be part of the future. These will do 3 or 4 things. Number one, they can form collagen because they can signal code to tell fibroblasts make more collagen. The second thing, they're involved in tissue repair. The third thing, which is interesting, is they're going to be involved in anti-aging because they'll be able to influence the telomeres. This is a little bottle of a secret thing that I'm not allowed to show yet, but it's coming out soon in another form of something called secretomes. So exosomes are
Secretomes.
tell the cell what to do,
Yeah.
but secretomes tell from one cell to another one to do. So one is intracellular, the other is extracellular. The thing about all these things, the technology is there, but what is inside the exosomes are the secretomes. So I have an analogy, it's almost like a train coming from China all the way to London. And we first look on the train, it's all these products, and we're saying, oh my God, isn't it wonderful? But most of the products are cheap and rubbish. So what we need to do is not look at the products, but the train. What cargo you put in the train. So once we can control the cargo, then we're really be able to use these things in a totally different way. It'll make your pancreas last longer. It'll make your heart sort of heal itself if it's heading.
It's all incredible.
The future is there. And of course, there's the old salmon sperm.
Oh, not again. So how does it? Just you've got to tell us how you get the salmon sperm. I mean,
They milk the salmon.
they milk them.
Yes, but the thing is, it's the sperm that has the DNA fragments.
Who
And
found
the
that
DNA
out?
fragments, well, they knew that DNA fragments could probably be used to code our DNA and RNA to help us in certain ways, particularly again for tissue repair and collagen. We've used polynucleotides in medicine for about 30 years in terms of wound repair, but this is the first time we decided, let's inject it into people's faces and make skin get younger.
Most of what we've talked about on this episode has been about the face.
Sure.
So I think in another episode,
Yeah.
I'd love to know.
Body contouring.
I've got a very long neck, you know, which I'm aware is getting a little older, and my, as you said, décolletage is what things you can do.
Before we even close this program,
Yeah.
you have what we call a turkey neck. It's very easy to treat that with Botox, just to be aware.
Just to put some in me. What's it?
Yes.
Yes. Well, I think on that note,
Yes.
we ought to say goodbye.
Can I have it? I've got a turkey neck now. I've got to go.
Join the gang.
Just be comfortable in your own skin,
Thank
turkey
you.
neck or not. That's all I'm saying.
I'm in good company.
Thank you so much for
Thank
coming
you,
in
Patrick.
again, because every time we meet you, I feel like we could talk for another 12 hours and still not hear everything. It's just incredible.
Thank you.
So thank you for watching, and join us again on Beauty Investigates.